Well, hello everyone, and happy National Hispanic and Latino Heritage Month. I'm Dr. Carl V. Hill, Chief Diversity, Equity, and Inclusion Officer at the Alzheimer's Association. It is my sincere pleasure to welcome you to the premiere of Memories of My Grandfather, a mini TV series that follows a Hispanic American family's journey with Alzheimer's. Here at the Alzheimer's Association, we still believe that engaging diverse perspectives is critical to achieving health equity, meaning that all communities have a fair and just opportunity for early diagnosis, treatment, access to risk reduction, and certainly quality care. We hope that today's presentation will provide our audience, you all, with information and resources that can help with family members and networks impacted by Alzheimer's or another type of dementia. So we are recording this presentation, which will be sent out to those who registered but weren't able to attend the live webinar. To ask questions, please use the Q&A feature, and we will answer questions immediately following this telenovela. We are so excited and thankful for your participation. Thanks to all of our partners. Thanks to everyone that helped put this together. Okay, let's start the show.
Papa.
Not now.
But abuelo's in the neighbor's lawn.
He won't leave.
Okay. Sit down and watch the game for me, okay? But pay attention.
I called your kids over. Your dad's been here a while.
I'm so sorry.
Don't worry.
Papa, what are you doing?
Watering the grass. What else?
This isn't our yard.
Yes, it is. Oh, I didn't notice.
Let's go home, okay? I'm so sorry.
Don't worry about it.
Papa, is everything all right?
Of course.
How odd.
This had never happened to him before.
You know, mi abuela had a similar experience.
Really? When?
Many years ago. It was one of the first signs.
Signs of what?
You know, she had Alzheimer's.
You think my dad has that?
No, I didn't say that.
Papa's healthy.
I'm just saying, my only regret was not getting her checked early.
It's late.
It wouldn't hurt to take him.
And with what money, huh?
There's a Latino clinic that helped your cousin Letty without insurance. Think about it.
Okay.
Can we get candy?
No.
Papa,
Tell me, mija.
is abuelo all right?
Of course. Why'd you ask?
Well, this morning I saw him brush his teeth with shaving gel.
Well, I'm sure it was just a mistake.
Yeah, he'd spit it out.
I would have too. Orden for Armando.
I had to help Abuelo tie his shoes today.
Tie his shoes?
Yeah, I saw him struggling, and after I helped him, he said he didn't even need my help. We should take him to the doctor.
Your abuelo is a very strong man. I'm sure he was just having a rough morning.
Mom said we should.
David, this is grown-ups business, okay? Call your mom, mijo.
Okay, for what?
Let's make that appointment.
Ama?
So, what can we do?
There's no need to do anything. I'm fine. Look at me.
Papa, please.
Sir, Alzheimer's is nothing to be ashamed of. It affects 1 out of 10 people in this country. You guys did the right thing coming to us early.
Okay, but what should we do now?
I'd recommend looking for areas in your life where positive changes can be made. For example, eating foods that are healthier in nutrients, adding a 10-minute walk to your day, and of course, getting enough sleep. All of these can help with Alzheimer's.
But I don't have Alzheimer's. I just forget things from time to time.
Papa, please, listen to the doctor. She's just trying to help.
There's more to Alzheimer's than memory loss, and from what your sons told me, you exhibit a few of the symptoms.
Like you don't get confused?
Okay, there are 10 overall signs. Besides memory loss, there's difficulty solving problems, difficulties doing day-to-day tasks, confusions with time and location, etc.
What are the others?
Having trouble with speaking and writing, misplacing things and blaming others, poor hygiene, changes in mood, and social withdrawal.
Okay. What else can I do?
Come back to my office so that we can keep checking up on you. Look, Don Leonel, I know this can be challenging, but I, along with all the other doctors in this clinic, are here to help. You guys are in good hands.
All right then. We'll be back.
What's this?
They're vegetables, mi amor. They're good for you.
Can't we have pizza?
Yes.
I'm sorry, mijo, but the doctor said we should be taking care of your abuelo. We have to be supportive of that.
We're going to be here for your abuelo as a family and adopt a healthier lifestyle along with him. Watch. It's gonna be good for all of us.
What's gonna happen to Grandpa?
Your abuelo will still be your abuelo. Always. Though he'll also be going through some changes.
Kids need to know this because we didn't have anybody to educate us on these topics growing up.
That's right. You know, Latinos are more likely to develop Alzheimer's. We have to support each other and stick together.
Why are Latinos more likely to develop it?
What's Alzheimer's?
I love you kids.
No, seriously, I don't know much about it, and I want to help Abuelito.
Me too.
To answer your question, Alexis, Alzheimer's is a disease that a person develops. It worsens over time and it can affect a person's memories. But hey, it's okay. Sweetheart, your grandpa is strong.
Nothing can bring us down.
No one has answered my question. Why are Latinos more likely to develop Alzheimer's?
Well, there's different factors. That's why the doctors say we must eat well and stay active, and do our part to make sure other Latinos are informed.
You know what? I'm gonna try out for the soccer team.
That's what I've been telling you.
I'm gonna be Messi.
I'm gonna be Simone Biles.
That's not soccer. Plus, cheerleading is lame.
Gymnastics. I think it's pretty cool.
Hey, no fighting at the table. You kids can be whatever you want to be.
And that is why we came to this country. I just put Papa to bed. He wouldn't stop talking about his plans.
I don't know that. You know how he is. You want me to put on the game?
You can keep watching your show. I'm just tired.
You need a break. You've been worrying about everyone else but yourself.
I tell him to rest.
You are important too.
I just can't stop thinking about my dad. Keeping our family afloat.
My love, you do enough. Why don't we go out tomorrow? We can all go to the park, take a walk, have a picnic.
That'd be nice. Yeah.
Okay.
You always know the right thing to say.
I know. What a beautiful day.
I wanted to stay home.
But it's good for us to walk, Dad. You can't just stay home.
Can we play?
Yeah. David, come on.
Abuelo, don't let her take me.
Listen to your mom, David. If I was your age, I'd be on top of those swings.
Okay, fine.
What's wrong?
Forgive me, son.
Forgive you for what?
I'm your father. I'm supposed to be taking care of you. My body isn't what it used to be.
Papa, don't apologize. You brought me to this country so we could fight for a better life. And that's what we're gonna do. Fight together. I love you, Dad.
I don't want to forget you.
We're gonna remember everything together. The doctor gave us some really good tips.
I want to walk around the neighborhood every day and sleep early.
How's it going?
Good. Bring me here more often.
Papa.
Can we listen to something else?
Why?
I don't like it. I want to listen to American music.
David,
I like it.
David, do you know where this music is from?
Yes, it's from Mexico.
And what does that mean to you?
Nothing.
Mexico is your home.
No, it's not. It's Houston.
When I was your age, I listened to corridos all the time. I miss my dear Mexico.
I'm sorry, Abuelo. You know what? I do like it.
There we go.
Abuelo, can you tell us stories from Mexico?
Where to begin?
Hello, hello.
Hi.
Beatriz. Good to see you.
Good to see you guys. Come in, come in. Don Lionel is here, but the kids are at practice. Armando, Leti and Osvaldo are here.
How are you?
I'm good, good. Everything's good.
What's going on? Why are they here?
They're here to see you.
Hola, tío.
Why? It's not my birthday or my funeral.
We're here to support you too, Theo.
Why are you telling people my business?
Dad, what are you saying?
They're a family too. They have to know.
Par de chismosos.
Dad.
Look, we brought you something.
Let's see. Now we're talking. What's this? Where's my gancitos? You always bring gancitos.
All right. Dad, get over here.
I don't want to.
You're gonna let us win all this money? That's nice of you, Theo.
Let me pass these around.
Okay.
Hey, how was practice?
It was good.
Alexis fell.
It was worth it though. You were putting your all into it.
Yeah, just like Abuelito says. Échale ganas.
There you go.
El valiente.
Échale ganas, even en lotería. Buenas.
He cheated.
Don't say that.
Yes, he did. I saw you, Abuelito.
Don't disrespect me this way.
Yeah, the kids were just having fun.
Yeah, there's no need to get upset, Theo.
You're right. Sorry, Osvaldo and Letty. Sorry, Armando and Beatriz.
It's okay.
I know what got into me. I'm sorry to your two kids.
It's okay, Abuelito. I was just jealous that you got to win all the money.
There's no need to be jealous in this house. We're a family, and we share. Now you all want.
What about you, Abuelito?
I will never day just by having you as my family. Thank you so much for being here with me.
Well, thank you for having me, Abuelito.
You want to go for another round?
Yes.
All right.
Relax. You're gonna be there on time.
You know how heavy Dad sleeps. And plus, I haven't made his breakfast. And we have a long drive. What if we need to stop and get gas? Did we get gas yesterday? I gotta go. Love you. Papa, it's time to go. No time for a full course meal.
Sit down, son.
You got up and made breakfast?
Of course. Can't go to my appointment on an empty stomach.
Thank you, Papa.
You're welcome.
I'll sign you in, Dad. Sit down.
Thank you, mijo.
Come on, Dad, it's important. I don't know why you insist. I don't need to see the doctor.
Just wait here, please. Here.
What's this?
For your appointment. Fill it out.
You do it for me.
But it's in Spanish.
I'm your father. Mijo,
Yes?
bring me water.
Of course.
What are you here for?
My son dragged me here.
What for?
He wants me to get checked for Alzheimer's. I've been healthy my whole life. Why should I get checked by a doctor?
You know, I thought the same as you once.
Once? What changed?
I realized that I'm not doing this just for myself. I'm doing this because I want to be here for my family. My life includes so much more than me alone. I have a son, grandkids, nieces, and nephews. I love them all. I know they only ask me to come to the doctor because they love me too.
That boy, he's your son? You raised a great man.
You did too. He's trying to help.
You're right.
We're not alone.
Who's that?
Someone I just met, but we have a lot in common.
Oh, yeah? That's great.
Leonel Hernandez.
It's time, Dad.
Welcome, everyone, and thank you for joining us here in today's webinar. I'm Gabby Del Moral. I'm a board member of the Alzheimer's Association, Minnesota, North Dakota chapter, and I will be your moderator for the rest of the afternoon and this webinar. Hispanic Latinos are one of the fastest growing cultural groups in the United States, and roughly 18% of the United States population. Nearly 1 out of 5 U.S. residents identifies as Hispanic Latino, according to the U.S. Census Bureau. It is expected that this number will grow to 28%, or 111 million people, by 2060. As the population ages, the number of Hispanic Latinos, older adults, quickly grow. By some estimate, this number is doubling every 15 years, according to the Pew Research Center. They're also disproportionately affected by various health conditions. These health-related discrepancies or disparities have significant implications as the population ages. In fact, compared to non-Hispanic white individuals, Hispanic Latinos have 50% greater risk for Alzheimer's disease and related dementias. In addition to seeking help later than other groups, Hispanic Latinos individuals are less likely to take medications available for Alzheimer's disease symptoms. Issues of trust and access to medical care, as well as perceptions of what is normal as aging, likely contributes. Now I would like to welcome our panelists, and I would like to start with Dr. Luis Medina. He is a bilingual and bicultural licensed clinical psychologist and cultural neuropsychologist, and he's an associate professor in the Department of Psychology at the University of Houston, where he directs in the collaborative on aging research and multicultural assessment lab. And he's also the director of the NIH-funded Engaging Communities of the Hispanic Latinos for Aging Research Network, a multi-site collaborative efforts to address the limited diversity in aging research samples. His research examines culture, cognition, and aging, particularly in the context of Alzheimer's disease and related dementias in population historically excluded from research. Welcome, Dr. Medina. Dr. Melissa Laddick is an assistant professor at Johns Hopkins University School of Nursing with appointments as core faculty at the Center of Aging and Health and principal faculty at the Center of Equity and in Aging. She's has expertise in behavior changes, aging, and social determinants of health. Her research focuses on the intersection on how stress, self-efficiency, and social-cultural factors influence aging in multiple chronic conditions, as well as the development of strength-based person-environment strategies and policies to improve outcomes. Dr. Laddick maintains a clinical practice with primarily Spanish-speaking communities in Baltimore, Maryland, teaches both DNP and PhD students, and advises multiple Latinx nursing students groups. She is a director of the National Association of Hispanic Nurses and the immediate past president for the NAHDH and DC Metro chapter. Welcome, Dr. Laddick. Dr. Maria Fernandez was born in Tampico, Mexico, and moved to San Diego, California when she was 3. Her bicultural and bilingual upbringing has had a major impact on both her personal and professional life. She pursued an undergraduate degree at Stanford University in the community health and cross-cultural medicine, followed by a master's in public health at UC Berkeley. She applied to medical school knowing that she wanted to be a family doctor who practiced at the federally qualified health center. She completed family medicine residency and currently practices as a family physician in Reno's largest FQHC, Community Health Alliance, where she primarily sees Spanish-speaking patients. She has served as a medical director at CHA for 3 years, bringing her passion for medicine and public health every day. Furthermore, for the last 4 years, she also serves as a community faculty at UNR School of Medicine, where she mentors and helps train PREMT students, medical students, family med residents, and advanced practitioner students during their medical journey. She's honored to serve as a co-chair of the Nevada National Hispanic Medical Association chapter, where she advocates for the Latino community and works with a team of colleagues across the country to improve Latino health. Welcome this afternoon, Dr. Fernandez. Ms. Yarisa Reyes is the National Director of Diversity, Equity, and Inclusion Engagement for the Alzheimer's Association, leading strategic initiatives to reach underserved communities in the pursuit of health equity. She leads national partnerships to increase access to resources and support for all the affected by Alzheimer's and all other dementias. Ms. Reyes collaborates with partners to spearhead initiatives that are culturally tailored, ensuring communities have access to Alzheimer's and dementia education and resources to reduce the racial and ethnic disparities in dementia care. Thank you for being here, Ms. Reyes. And Ms. Christine Perez is a director of the program at the National Hispanic Council on Aging, a national organization that works to improve the lives of Hispanic older adults, their families, and caregivers. Ms. Perez has years of experience as a program specialist and effectively implementing and managing social and public health programs that are used to boost fundraising, increase partner membership, enlist support from government agencies and corporations, and to benefit older adults, their families, and caregivers. Ms. Perez is passionate in working to reduce health disparities among the Hispanic community, particularly older adults, and for this population to age in the best possible health and dignity, and continue to be involved in community outreach with this community, the Hispanic community. Thank you all for being here. And now I would like to remind all the attendees to please make sure to put all your questions in the chat and we will answer them as quickly as we can. But I would like to open the questions with Dr. Medina. Can you please tell us how this idea for the telenovela came about?
Thank you so much, and a pleasure being here. The telenovela really came from talking with community members. And so we've been, for the last several years, working really closely with community members and other partners in 3 different cities. So I'm located in Houston, Texas, but we have a site in Denver, Colorado, and another site in Las Vegas, Nevada. And what we did was really work closely with folks in each of those cities to host these sessions where we really learned a lot from community members regarding what the key messages about Alzheimer's disease needed to be for Hispanic and Latino communities. With an emphasis on focusing the language to something that can be convey the messages we needed to convey, but that were sensitive to the needs of our communities. And when we worked through that, one of the questions that we brought up was, well, how do we get this messaging to them? And one of the suggestions was to make these short videos like a telenovela that's very recognizable within our culture and within our families. And so we did that and held a competition for folks to write scripts and submit their scripts. And the winning script is ultimately what was produced, and it's what you see here. And we made a general casting call and got folks from the community to be the actors. And so we like to say that this whole series is truly by community, with community, for community.
Wonderful. Thank you so much, Dr. Medina. Yarisa, what is the difference between Alzheimer's and dementia? If you can tap a little bit into that.
Sure, Gabby. Well, dementia is not a single disease. It's an umbrella term, like heart disease, for example. It covers a wide range of conditions that affect memory, thinking, language, problem solving, and even personality. These changes are serious enough to interfere with daily life and independence. And they don't just affect the person living with dementia, they ripple out to families, their networks, their communities even. Alzheimer's disease is the most common cause of dementia, accounting for about 60 to 80% of all cases, but it's not the only one. There's vascular dementia, for example, that has to do with heart health. Frontotemporal dementia has been in the news lately. Actor Bruce Willis has been diagnosed with frontotemporal dementia, for example. And some people experience mixed dementia, which is more than one type combined. There are other conditions like thyroid issues or vitamin deficiencies that can cause dementia-like symptoms, but they're actually treatable and even reversible. And so that's why it's, the understanding this difference really matters. That's why an early diagnosis really matters.
Can you tell us a little bit about the signs that we need to look for? What are the early signs, please?
Sure. Actually, I'm going to pivot that over to Dr. Medina.
Great, thank you. There was someone in the chat that mentioned how the early warning signs were mentioned a little quickly by the doctor in the video, and so it's a good opportunity to recap these. And in the chat, we just put in the resource for these 10 warning signs. Essentially, the brain is involved with a lot of different behaviors that we see in our day-to-day life, and pretty much changes in any of these things that we would expect we should be able to do can change with the process of Alzheimer's disease and other causes of dementia. These include things like remembering things that you typically wouldn't have trouble remembering. And so, for instance, my grandmother, when she started showing her first signs of Alzheimer's disease, she was forgetting how to cook recipes that she had known and cooked for many, many years in her life. She was beginning to forget how to do things in the kitchen, which was an area that was very familiar previously to her and very comfortable. We can also see some language changes. We can see people getting lost in familiar areas. We can see trouble with orientation, remembering kind of where you are or what time of day it is. Planning and organizing can become something that's challenging and can affect things like making sure our bills are paid in a timely manner. And so if you see a loved one is having trouble either remembering to pay utility bills or other things that are recurring, or even figuring out how to pay those bills or other things that were very familiar to them, these all may be early signs of something happening within the brain.
Thank you so much, Dr. Medina. Dr. Fernandez, I would like to invite you here for the next question here. And how does the Latino community that you work with or Hispanic community more generally view aging and dementia and how that might influence the caregiving or getting a diagnosis?
So thank you so much for having me. So I would say that Latinos, I am lucky enough to be able to take care of lots of Latino patients, and I do family medicine. So, newborns to my elderly patients. It tends to be a very family-centric community, right? And so usually at the doctor's visits or when they come and see me, it's like the whole family is here. What does happen though is my Latinos are less likely to come get primary care. It's either for socioeconomic reasons, they don't have access to health insurance, they don't know where to get care, they deprioritize their health care. They're so busy building a life for their families that they often say, no, I feel fine, so I'm not going to come to the doctors. I mean, we saw it in the video. And so usually they say, oh, I don't need to go see the doctor. I'm fine. And so they're prioritizing putting food on the table, prioritizing going to work, getting bills paid, doing all sorts of things. And so we have this amazing community of Latino, like a growing Latino community here in the US, but they're not getting care. They sometimes don't have access to culturally or language appropriate care. So they don't have physicians, they don't have providers who speak their language who are able to communicate with them. And then they're just late to care. So they're totally disproportionately affected by, something like dementia or Alzheimer's. They come in and we're kind of playing catch up a lot of the time because they have under or undiagnosed hypertension, under or undiagnosed diabetes, under or undiagnosed, all sorts of things. And so it really is, our Latino community has so much beauty in it and is so family centered that really, I think this telenovela, the call to action is to really get your loved ones checked, right? And that there are so many healthcare resources like federally qualified health centers that offer health services to anyone regardless of insurance.
Thank you so much, Christine. So let me see here. So what do you think, I'm sorry, this question goes to Christine. What do you think are the biggest barriers to assessing dementia, relating support and service for Hispanic families? If you can tell us a little bit about that, Christine.
Yes, absolutely. I wanted to echo of what Dr. Maria Fernanda just mentioned, and I'm going to highlight it again, that it's the language barriers, including also the need to translate like health information into Spanish, and even the challenges, just as Dr. Maria Fernanda mentioned, when communicating with healthcare providers. For instance, many Hispanic older adults, they're monolingual, and on occasions they prefer to receive information in Spanish. but the limited number of bilingual healthcare providers makes the access to care a little bit more challenging, let's say like that. We also have the stigma around Alzheimer's. Many Latinos associate the disease with memory loss or that they're crazy when that's not the truth. And many are not fully aware of other symptoms. And even if they experience them, it's, they tend to attribute it to mostly to the aging process. So that's why it's very important, the signs and symptoms, just as Dr. Medina just mentioned earlier. And we also have, this is very important to highlight, the immigration status. Some of the people, right, have that fear or reluctance to seek for services, even when the support it's available. Some of them have lack of health insurance, which of course it limits the seniors to access to care or visit their healthcare providers, for example. And also we need to highlight the caregiving burden. I know in the chat someone mentioned their experience as a caregiver, and this is important to highlight because Hispanic families often rely heavily in family caregiving, like the daughter or their granddaughters, or that could be the son, for example. And they unfortunately have limited external support. Many of them have more than one job. And also they need to care for their loved ones, which this can lead to stress, to burnout, and financial strain when caring with their loved one that has Alzheimer's, for example. And just before ending, there's a lot more, but I also want to highlight that we need to take into consideration the lack of transportation as well from the seniors to visit their healthcare providers and receive those type of services. And even the lack of access to the internet that, again, may limit them from receiving the information or help when accessing for Alzheimer's related support and or resources, for example.
Thank you so much, Christine. Dr. Ladek, what certain medications affect the Alzheimer's diagnosis?
This is a really great question, Gabby. Thank you for asking this question. Because there's as we age, we also can sometimes have other things that happen, and particularly we can have trouble sleeping sometimes. And then when we have trouble sleeping, we want to sleep. Everybody says sleep's so great, so we take a little Benadryl, right? A little Benadryl makes you go to sleep. Benadryl is a drug that can cause something called pseudodementia, especially in the mornings. And someone can be really confused, and then their family's like, what? I've always been a multi-generational family, and my mother lived with us for a while, and now my aunt lives with us. But my mother would just be like looking in her wheelchair, looking for the car keys to take my daughter to the movies with her friend, and she doesn't drive. She hasn't driven for a long time. She has hemiplegia from a stroke. And and it was like, you can't drive anywhere. And we realized that she was taking a little bit of the Benadryl on her own. And then also there's other drugs, there's other sleeping aids that sometimes are even prescribed and are really effective when someone's more in their midlife for short-term sleep aid. But for older adults, when people get older, those meds can also make someone have symptoms that look like dementia, but it's actually because of their medicine. There's other medicines too, even some blood pressure meds. If someone's blood pressure is really low, they're not getting enough oxygen to their brain, and they can get confused too.
You mentioned some sleeping meds. Can you name those few? Are there a few you can name?
Yeah, Ambien. We've all seen commercials for that, right? And I'm trying to remember what the generic Zolpidem, I think, is the generic name for that. Is one of the big ones. So all those Lunesta, all those sleep aids, some of them are better, some of them are worse. But there are medications that your doctor, your nurse practitioner, your provider can actually give you to help you sleep that are much safer. So you can have that conversation and those will not have the same pseudo dementia effect.
So we got to look out for sleeping meds and blood pressure meds, right? Check with our doctor. Thank you so much, Dr. Alec. Dr. Medina, what tests are recommended by doctors to give accurate diagnosis at this time?
Thank you, Gabby, for that question. I just want to piggyback also with what Dr. Loddick was mentioning is that, you know, clinically, sometimes we ask people what medications they're taking and they don't tell us everything that they're taking. And sometimes they might be taking some stuff that's prescribed and some stuff that's not prescribed, maybe over the counter or that they got from a friend or something. And I noticed somebody in the chat had mentioned, you know, like taking NyQuil as a substitute for sleeping aid, that there's a lot of stuff that can counteract with other medications or interact with medications. And so if a doctor asks, what medications are you taking, feel free to just say everything, including some of those over-the-counter things or even vitamins, etc., just in case there are some interactions, because sometimes the medication alone may not interfere with your cognitive abilities or make these symptoms, but when taken with something else, there may be an interaction there. But to your question regarding what tests can be done, there's sort of two types of tests, and I think it's important for us to distinguish, you know, what is part of the actual disease of Alzheimer's disease, which a lot of folks are talking about right now clinically, but then also kind of what's part of the presentation or the clinical syndrome of the disease. And so some places now are testing out or even starting to employ some blood work, some blood tests and other types of tests that may give us some indication that there may be some Alzheimer's disease, but that by themselves they're not enough to really diagnose the clinical syndrome of an Alzheimer's disease or related cognitive problem. And so what a lot of primary care providers, and I also saw that there was a question regarding what are we doing with primary care to make sure that we're raising the red flags early, is by working closely with primary care so that they understand some of those blood tests and other types of tests, but also to be able to provide questionnaires and other types of brief tests that can give us some indication that somebody might be having something in terms of problems with their day-to-day thinking abilities that should require or a referral to additional care or additional assessment. And so as a neuropsychologist, we do longer assessments. You know, it can be something like an hour or 2 hours or even more to really understand what's going on with the symptoms of the disease. But primary care is able to provide some screening tools that can at least give an indication that there might be something going on. But the key is for folks to, if they really feel that they're having a problem, whether it's a big change from where they were before, or one of the things I ask patients to do is to compare themselves to other friends and family members that are about the same age. And if they feel that they're not functioning the same way that they are, it might be time to ask your provider for additional workup for Alzheimer's disease or related dementia.
Thank you, Dr. Medina. Dr. Fernandez, why are Hispanic Latinos more likely to develop Alzheimer's?
We talked a little bit about this. I mean, a lot of times the Latino community thinks that memory issues are just a normal part of aging, and it's hard to convey. I think this is why campaigns like this are really important, is really to convey that really when memory issues with all the different signs are affecting their daily living, that's not normal. That's something to kind of bring up. Additionally, we have, I mean, our Latinos are disproportionately affected by so many things: access to healthcare, being able to communicate effectively with their providers, speaking in their native tongue, speaking in Spanish with their providers. And in general, there are some things that we can do to help combat dementia, to combat Alzheimer's, right? And the things that they showed in the video, like healthy eating, exercise, games, education. Like there are so many things that you can do over your lifespan that can help with this. And with our Latinos, sometimes socioeconomically, it's they're unable to do this. They don't have access to healthy living, safe neighborhoods, so many kind of the complexities. And so I think that they're just so often late to getting the diagnosis. It's so moderate to severe once they get it, that there's so much more education, like Dr. Medina was saying, for primary caregivers, and also for the Latino community to know that it's not normal, right? That your abuelito or your mom or anyone kind of forgetting to do things, unable to cook their favorite recipe, that might not be the normal part of aging, and that they should absolutely bring it to their provider's attention. We have really great screening tools. The problem is our Latino community a lot of times can't read and can't write either. And so some of these screening tools entail, are difficult for communities that are illiterate, right? And so I think it's very complex. And so it's going to take a whole village of different interventions at different levels to help our Latinos be more appropriately diagnosed earlier in the disease process versus so late, which is what we're seeing.
Thank you so much. Definitely, there are a lot of factors affecting that, and the stigma in the culture is huge too, no doubt. Thank you. Dr. Ladek, in the Latino community, who typically cares for an older family member with a health issue, like what advice would you give your patients and their families in seeking help?
I think it's anybody really. Like I think in Latino culture, I think family can sometimes be very extended. So sometimes it can be a spouse, and sometimes it can be a grandchild, and sometimes it can be I know my titi lives with me now, so it's just like it could be all sorts of different family members. So I think there's a lot of people, and that can be both good and bad. There's usually one person that has the bulk of it, but this is my advice. Look, I'm a nurse practitioner. I've been a nurse practitioner forever. I'm a researcher. I research dementia and aging. This is what I do my research, but I am also a caregiver, and I have 3 older adults that I'm primarily responsible for. And let me tell you this is really important for caregivers. Whenever you are saying yes to something, you're saying no to something else. There's only 24 hours in the day. You say yes to one thing, you're saying no to something else. And you need to be real clear what that no is that you're saying no to. What are you saying no to? Are you saying no to sleep? Are you saying no to television? Are you saying no to time with your children? Are you saying no to exercise? You got to be real clear about that. You got to own it. And then you have to have boundaries as you need to. This is real hard. And you need to find the resources in your community. You need to ask for help and all that. But I think really the most important piece of advice I could give you is when you say yes, especially to caregiving, you're saying no to something else, and be clear what that no is. So I think that would be the most important thing I could say, especially with the unspoken obligation rules in Latino culture, especially for women, of like, this is what you're going to do. We need to be really careful about that. And so that we're not continuing the trends. So I think that's what I would say about that.
Thank you so much, Dr. Ladek. Yarisa, can you tell me a little bit, can Alzheimer's be prevented? Can you speak a little bit about brain health?
Yeah, it's a great question. Thank you, Gabby. Well, there's no way to really prevent Alzheimer's, but there is growing research showing that what we do every day can make a real difference in protecting our brain health. And Dr. Fernandez alluded to this earlier when answering her question, but there's a ton of risk factors for Alzheimer's and other dementia. Some things like age we cannot control, but others are within our reach. Science is still evolving, but the evidence is strong that positive everyday actions can make a difference in brain health, even lowering the risk of cognitive decline and possibly Alzheimer's and other types of dementia. brain health is important at all ages. It is never too early or too late to take charge of your brain health. As a matter of fact, this summer at the Alzheimer's Association International Conference, there's a study called the US Pointer Study, and it showed that a program combining exercise and nutrition, cognitive engagement, and even health monitoring can meaningfully protect brain health. This was a randomized controlled clinical trial that tested 2 lifestyle interventions in a large, diverse population of older adults at risk for cognitive decline and dementia. And the participants were either in a self-guided or a structured lifestyle program. Both of the lifestyle interventions in this US Pointer study showed improved cognition in older adults at risk of cognitive decline. The cognitive benefits were greater for the structure intervention than they were for the self-guided one. But, I mean, both groups benefited from this intervention. And this means that, you know, participants were able to, these structure group, these participants that were in the structure group following this regimen, they performed at a much higher level compared to the other group. It talked about, you know, the effect that it likely increases resilience against cognitive decline. And there's just a lot around brain health that we can benefit from. There's things we can do every day. Things like getting enough sleep. We talked about that earlier. Eating well, exercising, challenging your brain to learn something new, being socially active, you know, just keeping in touch with friends and family, challenging your brain to learn something new. I mean, those are all great things. And so I'm going to go ahead and put a link in the chat for people who want to learn a little bit more about brain health and what they can do in their everyday lives.
Thank you. That's wonderful, Janisa. Dr. Ladek, what is the importance of early diagnosis or early detection of Alzheimer's?
Yeah, no, it's a really great question. I think first of all, the reason people should seek out a diagnosis is because first of all, it might not be Alzheimer's, it might not be dementia, it could be something else, it could be thyroid problems, it could be something with the brain, it could be post-stroke, needs to, you know, so there's all sorts of other medical reasons that can be treated and modified. So that's the first reason. I would say the second reason would be because sometimes there is treatment for early diagnoses. And there are also clinical trials, you know, that are going on all over the country. This is a really big issue for our country, and we're trying hard to understand this issue. So I think those would be the 2 big ones. I think the other one that I would say is starting to get your support in order. I mentioned about the yes and no when you're a caregiver. But if you can start on this path and you can maybe stop the progression from being, let me see, where's my camera, from being like this to maybe being like this, because you're like, oh man, now I'm really motivated, I'm going to exercise more and stuff, you can perhaps sometimes slow the progression. So I think being more informed, having more education is always better.
Thank you so much. Dr. Medina, can you speak to the current treatments available to treat Alzheimer's?
Thank you. I'm going to piggyback off of what Dr. Loddick said, which is at the early stages is when medications are most effective. And it's something that's drilled in us as providers is that early. You know, when we have early diagnosis and early detection, it expands our window of opportunity. And so both from an intervention or treatment perspective, but also from the perspective of families have more time to plan and do advanced care planning. And it's very clear within our research that the medications, the treatments, not just the ones that we have that help with symptoms, but a lot of the new medications that are being developed right now and are making it to the market are most effective in the early stages. The problem is, and a lot of folks may not be familiar with this, but that by the time we see the first symptoms of thinking and memory ability changes in people with Alzheimer's disease, it's possible that the disease has already been changing their brains and the sort of the biology and chemistry of their brains for years, as much as even 1 to 2 decades. And so it's possible that by the time they finally get to the doctor's office, they have already been experiencing some changes from the disease for 15, 20 years. And so it's tough that because we also see that a lot of Hispanic families don't even get a diagnosis until people are in more severe stages, that unfortunately, if we keep waiting and prolonging that, it's possible that the treatments that we have for symptoms and the new treatments that are being developed that actually attack sort of the mechanisms or the pathways of the actual disease, that these treatments may not be as effective or they may not even be eligible for them. And so I can't stress enough the early piece there. And I think that really brings up the fact there are multiple questions. I don't think we'll get to all of them, but questions regarding risk and how how folks can identify their risk for this early so that they can talk to their doctors about it. There was a question regarding family history and what is one's risk if both of their parents had dementia, and we do see that people with a family history are at increased risk, but there are a lot of other risk factors, including many modifiable risk factors, meaning that people can actually make changes to those other risks to reduce their overall risk. In terms of things like genetics, family history, and so forth, that only accounts for a certain percentage, typically less than 50% of risk for Alzheimer's disease in most cases, not in all. But that there are all of these other things that we can be doing to reduce our risk, like Elisa mentioned, diet, exercise, and other things that help strengthen our brains.
Thank you so much, Dr. Medina. Dr. Fernandez, what should you do if a loved one may be exhibiting signs of dementia?
I would say my biggest recommendation is if your loved one is exhibiting signs, that you make an appointment with your provider with just that complaint. Don't tag it on to a hypertension, diabetes, any other sort of follow-up, but make sure you say, I want to focus today on the memory issues or the changes in behavior that I'm noticing for my loved one. That way the provider can really spend time. I mean, our visits are really short. I get like 10 minutes with the patient. And so if it's on top of we're changing medications for your diabetes and we're talking about the obesity and we're doing all sorts of things and hypertension and then headaches and back pain, and you're throwing in you're saying, hey, and I'm having difficulty with my memory at the very end, or the child says, hey, I noticed their memory is not great, then your provider is not going to be able to give the time and the space for the testing and then sending you appropriately to the specialist. So I would say if you're concerned, really make it a visit, and as your primary care provider should spend time going through your medication list, should spend time making sure you don't have that they don't have sleep apnea, depression, thyroid issues, like we were saying, reversible causes of things that could affect your memory, but could really kind of screen you appropriately and then send you to the specialist. But give it the space and the time it needs, because it's really important.
Thank you. That is excellent advice, because we tend to go and start tapping on all the different things that are wrong with our parents or whoever we're taking care of. Thank you again, Dr. Fernandez. Christine, the National Hispanic Council on Aging advocates for the inclusion of Hispanic Latino individuals in research to ensure treatments are effective for this population and pushes for broader public health initiatives. Can you tell us why this is important, please?
Sure. This is an excellent question, Gabby. So Hispanic older adults, as you mentioned at the beginning of the webinar, they are the fastest growing aging segment of the United States population. But Latinos are underrepresented in clinical trials, and even the amount of research related to Latino older adults, it's very limited. So the differences between people can often lead to different responses to the same medication. The age, genetics, gender, weight, ethnic origin, even the geographic location, all of this may play a role in how treatment may work or how safe it may be. So that's why for us representation do matter, since it helps improve the effectiveness and safety of treatments, medications. It can also reduce the health disparities, can strengthen the trust between Hispanic and Latino communities and researchers and the healthcare system. And just to answer the last question as well that you mentioned, well, at the same time, we're advocating for broader public health initiatives and in our programming that helps ensure us to provide like the prevention, education, and also the resources that are available to the Hispanic and Latino individuals, including their families and caregivers, in a culturally and also linguistically appropriate ways when reaching out to them.
Thank you so much, Christine. Dr. Medina, this question came from the QA. I'm interested in participating in research, but don't know where to start. Where can I find information on research studies?
Great point. So the Alzheimer's Association has Trial Match, and I think we can put the link to that in the chat. But Trial Match is sort of like a dating service for researchers and research participants. And so you create a profile on there that describes you, and you'll be able to filter out a lot of studies that are looking for folks that may be like you, and so that studies that you may be eligible for, including studies that can be done remotely, either over the phone or online, as well as in person in an area close to you. And we also have our own risk calculator that's been published. And we can drop a link to that, but it's our Community University Partnership Survey, or our CUPS, where folks can complete a simple yes/no questionnaire about certain different risk factors and get some immediate feedback regarding their risk after that. And if they want to learn more about research opportunities, they can check a box for that as well. And also, if you live close to any kind of university or medical center, typically research is going on, and I would encourage folks to just look online or elsewhere for opportunities within their cities.
Thank you so much, Dr. Medina. Here's another question. Is it more common in women, and what role do hormones play? Let's see who can answer that one for us.
I guess I'll go. The answer is yes. Women are at increased risk for Alzheimer's disease and related dementias. It used to be believed that it's because women tend to live longer than men, and so it might just be a function of women living longer. But various research studies have over the years found that even when you control for that comparison of how long people live, women still are at increased risk, and so it is possible that there may be some effect of hormones in that. And that's a big area of research right now, is trying to take a look at those differences in hormones, as well as other environmental and other factors to see why women are indeed at increased risk.
Thank you so much. Another question that came up is, are there any vitamins and minerals that we can take to delay the onset of Alzheimer's disease? My mother is 85 and suffering from it. And that goes to anyone who's open to answer this question.
So can you repeat the beginning of that question? It was,
Are there any vitamins or minerals that we can take to delay the onset of Alzheimer's?
great. I think Juan posted some information regarding what we have in terms of herbal supplements, vitamins, and minerals. A lot of research has looked into this and found that while vitamins, minerals, and other supplements may help with a variety of things, that they don't seem to be as effective for preventing or even treating Alzheimer's disease. Folks have looked at things like vitamin E, vitamin D, vitamin B, and fish oil and antioxidants and so forth. And while these things may help with, again, a variety of brain health or physical health factors, when it comes to actually treating Alzheimer's disease, they don't seem to be effective. With that said, and I'll bring it back to what Yarisa mentioned earlier, which is how we're, and several other speakers today, regarding reversible changes. If folks are having some sort of vitamin deficiencies, meaning significant under targets of these supplements, they may end up having some changes that can look like the early symptoms of cognitive decline or dementia, in which case they would want their PCP to do some blood work to make sure that all of those things are where they need to be.
Thank you. There is another question here or comment for you, Dr. Medina. Hello, Dr. Medina. It is so good to see you and have your participation. We still miss you not being in Denver. Anyway, can you speak to the benefits of connecting with promotores in their area? Thank you, Rosalind Reese.
Oh, so nice to hear from Rosalind. Thank you so much, and so glad that you're here in attendance. And I miss my crew over in Denver. It's been 7 years now. So, but the idea of promotores, for those not familiar, community health workers, connectors, promoters. These folks that are working really closely with community members and really know how to sort of broker language barriers, cultural barriers, and so forth with community members are a huge and vital asset to getting this information out there. And I think a theme that I saw in some of the chat was how we need more education. We need culturally and linguistically appropriate education, as our colleagues at NACOA like to tell us. That doctors aren't always doing a great job of it. Academic institutions aren't doing a great job of that. And we don't always know where the gaps are. But working closely with promotores, community health workers, etc., they're able to see where those blind spots are, where those gaps are, and help us address those gaps. Because knowledge is power, and if folks have that knowledge, they'll be empowered to make changes to their health and their care. And so we want to work very closely with folks from the community to be able to bridge those gaps. Great suggestion, and one that folks are I think realizing across the country for us to be able to improve care for all.
Thank you. Yarisa, here's another question. This goes to you. Are there publications in Spanish that we can share with our family members that explains about Alzheimer's?
That's a great question, Gabby. Thank you. Yes, we have a lot of information available in Spanish via our website, alz.org. We have the Spanish content on there that you can toggle to, as well as alz.org publicaciones, which is a listing of all of our publications in Spanish. We have brochures on there. We have educational programs available in Spanish. We have support groups in Spanish. And of course, we also have bilingual staff ready to answer questions at any time of the day or night via our 24/7 helpline, which is 800-272-3900. That helpline is a lifesaver for anyone who maybe don't even know where to start. Maybe they're noticing some signs in a loved one and don't even know where to begin. You can call our helpline and we will guide you through everything. We'll ask you questions and give you resources and information referral so that you can have your options, and we can guide you through that process with guided questions, things that you can bring to your doctor, questions you can go through with your family members so that everyone's on the same page. So that number again, our 24/7 helpline is 800-272-3900.
Thank you so much, Larissa. And there's a question that Dr. Medina, someone wanted for you to clarify, what is promotores?
Yeah, that promotores are community health workers, and so promotores and promotores de salud are community health workers that primarily work with the Hispanic Latin American community. I think Dr. Lodick has their hand raised, so I'm going to defer.
Yeah, I just wanted to jump in, actually piggyback on that idea that, there's been some legislation movement to have Medicare and Medicaid pay for community health workers. And also this is potentially very wonderful for our community. I've found that sometimes the Latino community is less likely to use some of the more traditional resources like senior centers. And so having more of a structure around things like promotoras, which are so well accepted in our culture, could be a real boon. And so getting legislation passed for those workers to be seen as more sort of standard of care, as a potential standard of care, would be really a wonderful resource for our community. So I just wanted to mention that.
Yeah, and for those that aren't fully aware of even what community health workers are, these are individuals that are primarily from the community that receive additional training in healthcare and health topics and maintain credentials to continue working in this space, and they become liaisons, or I've heard so many words: conectores, connectors. People who essentially are working closely with the health and healthcare systems, but closely with the community to, again, bridge that gap. And around the world, it's been shown that community health workers are able to promote and advance health within local communities in a way that if we rely solely on academic medical institutions, we may not be able to get the access that they're able to get.
And I'll just add something to that. There's a long history of faith-based organizations playing an important role in various cultures, including Latino culture. And so I think there's a place for sort of the promadora within like a parish nursing sort of construct that I think is really interesting. And there was someone on the call who I think has left, Dr. Fayron Epps, who does this work within the Black church community that I think we could learn a lot from as well.
Thank you. Here's another question, and again, I'll leave it open for anyone who would like to answer. Given the anti-immigrant climate of our current national administration, there is always a fear about reaching out for assistance through public agencies. Given that sad reality, what are the possible care options and in skilled nursing, etc., for our loved ones who may be non-citizen? Many of them won't qualify for Medicare or Medicaid help. If anyone would like to comment.
This is the population I work with is all not legally here for many years now. And so this is tricky, real tricky. When someone can no longer work and does not have an income, and then they do not get Social Security benefits, and then they do not have access to Medicare, it becomes really important what state they live in. There are certain states that have catchment insurance for people regardless of their status in the country. And then, so if you're in a state like California or the District of Columbia, for example, they offer some sort of catchment insurance that makes everybody's lives much easier as far as medical care. But there is something in the Latino community called the salmon bias, where people go home to their home country. Once they get to a certain amount of sickness, they go back, and the daughter that didn't come to the States and go and live with her, there's something, because it can be very tricky to figure out how to navigate medications. And I've been in that situation many times. So it's, I've seen it. We use whatever we can resource-wise from different drug companies. We use as many generics as we can, and even generics that might not be the best case for someone who's older. But sometimes it gets very tricky. Social determinants and evidence-based practice start to interact with each other in ways that are really tricky.
Absolutely. Jerisa, is the telenovela accessible on YouTube to share?
Great question. And yes, we, first of all, so thankful to be partnering with Dr. Medina and the University of Houston to showcase this telenovela series. We think it's a really fun way of educating the community through the arts, edutainment, as we call it. And we plan on embedding this webinar with the entirety of the telenovela onto our website so that anyone can access it at any time. So that website address is alz.org/memories telenovela. That is where we registered for this webinar. That is where we're going to embed this recording so that everyone has access to it. And we'll do the same next week when we do the Spanish premiere as well.
Thank you very much. So I think that's about it for questions. And I would like to close memories of my grandfather, where Armando and his family come together to care for their grandfather after his Alzheimer's diagnosis. Their journey shows how important it is to lean on one another and have honest conversations about memory loss. If you are caring for someone who is living with dementia, you don't have to go through this alone. Alzheimer's Association offers free support groups, local education programs, and online communities where you can connect with others who understand what you're feeling. Again, the Alzheimer's Association, the 24/7 helpline is available day and night. The number is 1-800-272-3900, or you can visit the website, alz.org, to find a local chapter near you. And our time has come to an end. I would like to thank our dynamic and amazing panel and everyone who has joined us today on this presentation. And always stay tuned with what's happening in the Alzheimer's Association.org. And we'll see you next time. Stay safe, friends. Till next time. Bye-bye.
Bye, everyone. Thank you.